once you are, and hopefully you're starting to think about what type of screening tool would make the most sense, and maybe even thinking about, how this would flow within your practice. Now we're going to talk a little bit about, how do you actually implement the tool, and, work with the patient on the results. Next slide, please. Yeah, so I know that I keep harping on this trust part, but I think we can't emphasize this enough, right? Because it is so deeply inherent and deeply rooted in traumatic experiences, especially when we're really talking about things that have happened earlier in life, right? So these things happen during development. And so it is not, a matter of choice of trust, but trust is associated with safety and threats, and really will kick in that reaction that we all have, which is that fight or flight response of when we're trying to assess for danger, right? So this goes down to a very cellular level. So building trust and maintaining trust is so essential. And that's really what we all want, right, with our healthcare providers. But it's especially important when we're thinking about people who've experienced early trauma. So some of the things that will be harmful, that could be re-triggering, that could be re-traumatizing for someone, or interactions that are humiliating, feel impersonal or disrespectful, right? Encounters that are rushed or abrupt can definitely exacerbate those feelings. Thinking about tone, right? So tone that is demanding or judgmental, condescending, or aggressive or authoritative, in its tone, whether this is written or verbal, even if there's instructions with the screener that aren't being conveyed in person, to really just keep in mind, does this help to build trust? Lack of mutual collaboration, alienating and complicated language. So Yael was talking a little bit about this earlier around health literacy and how important that is, right? And so thinking about the language that we use, and, are there ways that we can break down instructions, or even the conversation so that it's in plain language and easier to understand and to digest. And ultimately, right, feeling unsafe works against trying to establish this trust. So what would make someone feel safe and what would build trust? Well, basically the opposite in a lot of these situations, but interactions that express kindness, reassurance, acceptance, right? An environment that is patient, that is calming, frequent use of words like please and thank you, verbally and written. We want to acknowledge a person's ability to make choices for themselves, and we want to really do things and use language that can be re-empowering, that really allow a person to feel safe because they feel that they have an option, right? When we start to take away those options, we start to really make a person feel cornered and threatened, and that will work against what we're trying to establish here. Active listening and plain language, all of these contribute to feeling safe. And obviously that's where we're trying to go with all of this. And then providing options. And of course, there are a lot of other things, but this is really a baseline to start to think about what the environment is like, what is our tone, what's the language that we're using, how do we interact with our patients, how are other patients interacting with patients, and really wanting to think about this in all of our interactions, whether it's over email or text, on the phone or in person or in writing. Next slide, please. So communication is, I don't know about you, but I feel like I've been hearing this since, I don't know, the time that I was maybe before my first job, right? It's all about communication. And every day I'm reminded of how true this is. So in this particular situation, what we're talking about is communication, where we want to speak slowly. You know, a lot of these examples are thinking about in person, but that they can be translated into nonverbal, unwritten, or over or virtually as well, right? So we want to speak clearly, slowly. We want to speak at an appropriate volume. We really want to follow the lead of the pace of the patient that we are working with in that present time. We want to use the preferred language of a patient and not make assumptions. If you are working with a patient that is multilingual, let's not make assumptions that just because a person can actually speak in a specific language, that's the language that they feel most comfortable in communicating in. We want to use ORs from motivational interviewing, right? So open-ended questions, affirmations, reflections, summaries. We want the conversation to be open. We want to allow for opportunities for people to ask questions, for people to reflect, for people to really absorb what we're asking them to do with the screening. We always want to appear engaged, pleasant, calm. These are not always easy things to do, and that's why we're writing them in this PowerPoint, right? It's really hard to do this when we have a million other things that on our minds, or we have a full patient roster that day. So again, this is also just a really like a self check-in for ourselves. Are we able to do this, you know, as a practice, but also individually? And if we're struggling with any of this, what can we do, you know, to make sure that when we're engaging with patients, this is what we're conveying. Avoiding sudden movements, keeping hands out of our pockets. We went into a lot of detail in the last webinar around how to perform a trauma-informed examination. We spent a lot of time on communication, and definitely if you didn't get a chance to see it, you can go back and look at some of those tips there. And most important, pay attention to patient cues. You know, when we're really caught up in reading from a script or keeping up with our EHR, those are missed opportunities of really being present and picking up on what's happening with that patient, what their body language is like, what their eye contact is like, what the tone of their voice is like, you know, their facial expressions and how tensely they may be holding their body. Next slide, please. So how do we actually implement the screening tool, right? And Yael really set the stage so well for us earlier, right? Number one, we want to make sure it's by trained and prepared staff. This is not the time where someone can just step in if they're not familiar with the screening tool, if they're not familiar with what we're really trying to accomplish with screening, right? We want our staff and our colleagues to feel confident and comfortable with this, because that is what will be conveyed to our patients. We want to make sure that we have privacy for our patients and ample time for people to complete these screenings. They may be, you know, just 10 questions, but if you take time to really review these screening tools, these are really big questions that we're asking people to reflect upon. And, you know, if some people may not be ready to really reflect that long, but we want to give the option for people to really think about it and decide how much they can or want to share. If we're using a telehealth modality, definitely make sure that you are aware of privacy and comfort level of patients before doing a screening. And we just put this in there given, you know, how we're all operating now in the pandemic. So it's definitely possible to screen virtually, but that's definitely something that you'd need to consider and what else you're doing through telehealth, right? Direct and clear and simple language is the best, especially in using screening tools. We want to keep it concise, clear, and not overwhelm a patient. But definitely leave the door open for questions or needed clarification. Compassion, non-judgmental communication, and the way that we speak with people is really important. I know, you know, again, these are things that seem simple. And of course, ideally, we all are striving to communicate with everyone in our lives this way. But we put this here because, you know, definitely when we're overwhelmed, if we're rushed, if we don't have a lot of time, we may not be aware how, how we're delivering information. And especially, when we're talking about things like trauma, if you're someone who's used to talking about trauma in your work, sometimes it's easy to forget that this is could be a very foreign concept to most people and most of your patients coming in for care. We also want to make sure that there is an in-person opportunity to talk through the screening tool and the results. And again, using language that's most preferred by the patient. It's really helpful to start with some sort of a framing statement. And I think it's a great idea for you and anyone else who's on the team or in your practice or colleagues to think about what is going to be the statement that we're using, the language we're using to introduce this idea, so that it can be something that is normalized among your patient population, and to explain the reason why we're doing it. So we provided a few examples here. For example, because early childhood experiences can have a great impact on health throughout our lives, we are asking all of our patients to complete this questionnaire, right? It can be very simple. You can also go into a little more detail depending if you're the provider or the person who is administering the tool, but won't be reviewing results. So really using, giving the example that extreme stress or things that happen to us as children really can actually make us sick as we go through our lifespan. And that's also a reason why this might be happening in a doctor's office. Next slide, please. So these are some basic do's and don'ts of screening that are trauma informed, and you could apply this really to most screening tools that you are or may already be implementing in your practices. So we do always want to identify and validate existing strengths and protective factors that a person is already using in their lives, right? We do want to use motivational interviewing techniques. We do want to allow patients to fill out privately. If an adolescent and or an older child is able to and prefers to fill it out on their own, and that is who your primary patient is, we want to make sure that we're providing that option. We want to emphasize how the information will and won't be used. There can be a lot of hesitation and resistance to screening tools, especially when we're asking about such personal details in people's lives. Among all of our patients, but especially patients who have already experienced different forms of racism, discrimination, and other forms of oppression. And so we want to make sure that we are introducing the screening tool in a way that does not feel stigmatizing or that we are targeting a certain patient population, right? And so a lot of concerns may rise to the surface depending, around privacy, confidentiality, and just really, why do we want to know this? So really being ready to explain that in a way that is, straightforward, simple, compassionate, and also having time to really answer questions is important. We don't want to push or initiate a screening if you are working with a patient that is in distress over something else at that time, right? That is not the time to be pushing this. We really don't want to rush. When you are implementing the screening tool, we don't want to skip any screening questions. Sometimes that can happen because it's more around discomfort by the screening person or the provider or whoever is administering the tool, or our own kind of bias or projection around what may be uncomfortable for the other person, right? So we might skip one of the questions because we feel that it might be too personal or not apply to the patient. And that's really our own biases, right? So we need to be neutral and give our patients the option and the ability to choose for themselves. Don't doubt the validity of what is shared. So if we get a screening tool back and a person has a score of 0 or vice versa, they have a score of 8. We really, for asking people to fill these tools out, it is not our role to then question if what they're sharing is or is not true or real or accurate. Next slide, please.
Just a quick time check, Angie.
Got it. Thank you. And then similarly, when we're confirming results, right, you want to make sure that you have the tool that was actually used. So you want to make sure you know which one was filled out, and the results when we're talking through this with our patients. Explaining the rationale again, you really can't just explain this enough and really making that connection. Again, going back to this idea that, trauma is a word that we're using so frequently now in healthcare, and that's wonderful. But it's also not something that people fully understand, in everyday life. And also, I think that for a long time, trauma really remained specifically in more behavioral health and mental health realm. And so that now we're bringing this into medical care, many patients may feel or wonder, well, what does this have to do with my physical health? And are you trying to say that this is something that's, in my head or just emotional? So really being able to back this up with science and research that, this all connects to our actual health. And it's not something that we're making up or because, we were upset too much by something as a young person, that it goes much deeper than that. Validation is so important, and thanking a person for sharing or disclosing whatever it is that they were willing to. And then we want to definitely discuss the next steps. What's going to be done with this information, and how does it really get translated into their healthcare plan with you? Next slide, please. So what else can we do? Well, we want to make sure we leave the door open, right? I was saying earlier, it's too bad that there are some limitations around billing and implementing the tool more than once, because for some people it may need to be administered more than once, depending on, what's happening in their lives, or maybe as the relationship within your practice develops. So leaving that door open and really, making that connection more than once, not just in that confirming results conversation, but how are you continuing to use that information that we now have in improving quality of life and also health outcomes with your patients? We want to always believe our patients. We also want to know, it's really make sure it's important to understand the laws in your state and local jurisdictions around mandated reporting and limitations of confidentiality. And we're going to talk more about this in a few minutes. But again, of course, because you may have young people filling out a screening tool that may disclose certain things that are happening in real time at home. Or depending on where you live, you may have an adult, or depending on their state, they may disclose things that will require you to consider having to make a mandated report. And then we really, really, really can't stress this enough, that connecting with your local resources and other agencies, and if possible, doing this, continually, to be able to provide warm referrals for additional resources, right? Because we're asking about such a broad range of possible experiences a person may have experienced, and definitely the social determinants of health, right? We're going to need to know about a lot of different types of resources and social service needs for our patients. And so you can't start too early in developing those relationships. And, we all hopefully will continue to learn. This is kind of somewhat newer, really, which is a funny thing to say. But we're really all learning about how trauma and how stressors, how toxic stress really affect our health and our well-being across, throughout the lifespan. Next slide, please. So again, this is another slide, just if in case some of you are doing telehealth and you might consider screening through telehealth. The main thing through, doing things virtually, the most important thing is that, you're not in the room with someone. And so you can't necessarily pick up on certain cues that may be a little more obvious to you when you're in person. So that's one thing we want to just be mindful of doing anything virtually, that we are really emphasizing our own, communication, body language, what we want to convey, and that we're really paying attention to what we're seeing and hearing from our patients. We also really want to emphasize the importance of safety for patients that we're working with virtually, right? We don't know who else is in the room. We're all using different types of platforms, and everyone has a different type of, expertise or skill level in using them. So think ahead as far as what if you get disconnected, all of a sudden, how can you reach that patient easily? What do you already know about that patient that you need to consider if you're doing a telehealth visit, so that you don't put a person in a more compromised situation around safety? And I'm specifically thinking more around things like abuse or neglect or domestic violence that might be happening in the home. And always, follow the patient's lead, and really giving over, making sure that patients understand that they can really direct where the conversation goes or doesn't want to go. So we're happy to discuss this in more detail with you if you want to stay on later, but this is just a very simplified set of tips. Next slide, please. So challenges with the screening and using tools. And I'm sure many of you have been thinking about this already as we're going through these, but we did want to just note some of the probably more obvious challenges, and, and just to make people aware and thinking about this ahead of time so that you can also troubleshoot and how to overcome some of these possible challenges. Next slide, please. So we broke this up in working with adults and then working with children or minors. So some of the potential challenges with adults are that, presenting or introducing this screening tool may reinforce some of the distrust of healthcare by communities of color and or immigrant communities, especially, right? So that, again, it just goes back to what I was mentioning before, that we don't want to reinforce stigmatization, and we certainly don't want to contribute to what has already been, a very long-term distrustful relationship among people of color and in the medical field, right? So again, it's all about transparency and communication and how we set the tone and the stage from the beginning to really be able to mitigate some of these things, even if they're unintentional. And then also open up the door, let those conversations happen. If someone is concerned, allow that conversation to take place and be able to, rather than minimizing a person's concerns, really addressing what you can about those concerns. If the screening is not well explained, we're going to get inaccurate results, or maybe a person's resistance to even filling this out. And again, if providers don't ask all the questions during the screening, and we have heard some of this in the past a lot around that. And I think for both of these points, they come down to just the comfort level and the preparedness of whoever is implementing the screening tool. Health literacy issues. So if people can't fill out the forms and don't receive help or assistance, then again, it's going to really stand in the way of what we're trying to do. If the screening scores are not received by the provider by the time they see the patient, that can certainly lead to some real issues, right? And not just kind of the obvious issues around efficiency and effectiveness, but also what does that say to the patient that we ask them to do this and we're not able to talk to them about it. And, another potential challenge might be, how do we take this and incorporate it in a way that is relevant and matches the individual patient, right? We certainly don't want to start implementing screenings to lead to kind of over treatment or unnecessary referrals and diagnoses, right? This is supposed to help improve quality of life for our patients, and we don't want to do the opposite by just adding a whole other list of problems and issues and additional follow-ups that they need to have. So really weighing that balance and preparing ahead of time of what does this mean for our patients. Next slide, please. So a lot of the challenges and concerns for children and teens are the same. And then I think that probably something that many people may be wondering, and Yael mentioned this earlier, about what happens if a minor discloses something on the screening tool that may require further questions or a possible reporting, right? So the potential challenge or benefit, depending on what it is, could lead to increased reporting to Child Protective Services by raising suspicion. And this could be a challenge or it could be a benefit, right? I mean, this also is an opportunity to intervene in truly unsafe situations. But again, we need to be prepared and know what that process is within the practice so that we don't have this knee-jerk reaction of over-reporting. And then, another challenge with young people is what happens if it's the caregiver who's completing the screening on behalf of the child. Will there be, will they withhold some information, or will they just not be able to fully, speak on behalf of the child or the teen, right? We all have different experiences. And so the perception of the caregiver of what's happening in the home versus what the individual child or teen is feeling in the home might not be the same thing. Next slide, please. So what do we do if if our patients do disclose trauma histories, which will most likely happen because we know that a large percentage of the population have experienced at least one of the ACEs on that screening tool, if not two or more. Right. Next slide. So I think the first thing that I just want to say is that this may be the very first time in a person's life that anyone is even asking about any of these things, right? When you're an adult and you go in for healthcare, it has probably never happened that someone is asking you as an adult what your life was like up until you were 18, right? To understand your health better. So this is an amazing opportunity, right? But it will come with some challenges. So we want to make sure that we're acknowledging, validating, and educating with everyone, right? Education is so important and can be an intervention in itself. Preventive as well, right? We're going to provide referrals and support services and resources around social determinants of health that make sense and that are needed. And then creating and modifying a care plan, incorporating the risk level and screening results, right? Next slide, please. So some things that you can say immediately is thank you, right? We care about you. And then also talking about the things that you have been concerned about, as far as their health or their health outcomes, and then, making that connection between what you may have learned through the screening result and what those concerns are. You'll discuss referral options and appropriate resources. And I will say that most of the time they will just be optional, right? Most of these trauma disclosures are going to be things that happened in the past that are part of the past. As far as what I mean by that is that they're not necessarily going to require an immediate crisis intervention that's dealing with safety, right? And so that really does give you time to work with the patient, to discuss things with the patient, and to really learn what types of resources are they already tapped into and what might help to supplement or complement what they're already doing, right? And then in situations where mandated reporting may be necessary, you are going to want to explain that reporting obligation, right? It should never be something that catches a patient by surprise or done in secrecy, right? We want to go back to that trust building again. Share the reasoning, and then, if at all possible, create that plan with your patient together, right? So if it is a situation where children's services need to be called or the police need to be called. It can be done with a patient. It doesn't have to be done aside from or without the patient, okay? Next slide, please. So things that we don't want to say, which I think are probably more important, right? There's no perfect response. What's most important is to respond authentically and genuinely and with enough patience that you can, be in the moment. What we want to avoid, though, is we want to avoid making excuses or rationalizations about disclosures that were shared, right? And that's kind of a human reaction when people share something that sounds painful or are upsetting. We want to make them feel better, right? We want to fix it. And certainly in the healthcare world, right? We all probably have gone into patient care because we want to do something about it. But what we really want to do is just allow the person to share and thank them. But really, we're not going to need to rationalize or explain further what happened. Everyone who's experienced a traumatic trauma in their lives already knows, right, what has happened to them. What we want to do is just validate whatever is shared and how they are feeling, but not to tell them that they shouldn't feel that way. Be mindful of labeling or stereotyping based upon the results of screening. And then, really just pay attention to your own body language and facial expressions, because we don't want to react with shock or alarm that's written all over our face, or pity, right? Compassion, absolutely. It's okay for you to feel, have empathy for if a person is, sad when they're sharing something, for example. But we want to keep things open and we don't want to shut off. So any sort of communication or words or body language that may force a person to kind of put that wall back up, that's what we're trying to avoid. Next slide, please. So again, really the main,
Check, Angie.
Thank you. The additional considerations around high risk or acute situations. So this is really first and foremost, right, it's patient safety, and that's with everything. If you are implementing a screening and this screening somehow has triggered a person, or going through the results, they've disclosed something where they are in danger because of someone else. So for example, if there's a disclosure with children or minors where there may be violence or neglect in the home, right? Then we want to consider, is this person in danger? If an adult discloses that they're in danger, possibly wanting to hurt themselves or someone else, or are experiencing domestic violence or sexual violence, in certain states, that could be a mandated report, right? And then we also just want to consider confidentiality. And again, what is that conversation for you in your practice? How do you introduce the idea of privacy and confidentiality with your patients in general, right? Because there are times where that we can't completely keep things private, right? So for most, I think, patients, this will not be surprising necessarily, but I think we just wanted to introduce this because whenever you're kind of introducing a new tool or starting conversations about things that have never been discussed before, to anticipate that there may be disclosures that will require us to act more swiftly and really around safety measures. Next slide, please. And I just mentioned these things. So again, I know people are calling in from all over, which is amazing. I think for child abuse and neglect, the standards are pretty similar across the country, right? And healthcare workers, anyone in healthcare working directly with a patient, there are mandated reporting laws. And then around sexual and domestic violence that may either be disclosed by a child or a teen, or an adult. In some states, these are also mandated reports. We know in California they are, and so it's good to be aware of that. And again, to just anticipate how those conversations will happen with your patients, and how can you do it so that it's not triggering, but that really emphasizes it's for the safety and well-being of your patient. Next slide, please. So we get to the part now of, well, what else can we do? What else is out there to support patients who have a trauma history? Next slide, please. For adults, a lot of this will obviously also come in education, which can be so helpful. And we've taken this, actually, most of it from the acesaware.org website. So I won't read this list exhaustively. What I will say, though, is that around trauma, really what all of the approaches to trauma really are about is building resilience, right? Buffering toxic stress that may continue to exist, especially within considering social determinants of health. And what are the things that we can do to promote overall well-being with our patients that can help to mitigate the impacts of this stress, right? So everything from eating healthy, regular sleep, and how important sleep is. And we're seeing that more and more with recent studies around sleep and COVID and our risk to even that virus. And this is going to look different for everyone, right? Next slide, please. So everything from things that help to engage a person with the outside world, hobbies, socialization. So, right, going back to that trust building, and that trauma often breaks that connection with ourselves and others. So all of these recommendations really are taking that into consideration, right? So things that may be things that bring pleasure, things that bring positive feeling, things that can counteract stress, things that connect us to community, to support. All of that helps to build resilience as well, and really helps to counteract that feeling of isolation and aloneness that most people who have trauma in their lives carry around with them. Next slide, please. With children, obviously some things will be different and some things will be the same. Again, we still want that connectedness. We want to connect children with support. We also want to help children with additional outlets on how to express what they're feeling when they may not have the words. So journaling can be really helpful. Artwork can be really helpful with adults and children. And quite frankly, all of us right now, what we're all living through, working on breath exercise and grounding techniques really help us to slow down our heart rate and really help to resist that, the triggering of our fight or flight reactions, which is really what, a lot of that stress is coming from, and also what eventually can lead to disease. Next slide, please. For babies and toddlers, we wanted to just mention and point out how important attachment is. And when trauma has happened to someone very young or in their developmental stages, depending on when it happens or by whom, so if it was from the parent or the primary caregiver, that's what we're seeing. We're seeing a disruption in attachment. So what we want to do for well-being of toddlers and babies is, how do we emphasize and how do we strengthen attachment? And that really will require working with the caregiver, right? And the baby or the toddler. But that what happens is, when there's a stronger attachment, it really sets up protective factors for all other stages of development for children. And then eventually, right, we see that positive impact as adults. Next slide, please. And this just goes through some of the list, right? And as you can see, that the benefits of strong and healthy attachment really are the foundation for the whole person. So when you have a strong and healthy attachment, it helps to build self-confidence, our own self-worth. When we have that confidence and self-worth, then we have more ability to interact with others in a positive way, right? And when we have successful social interactions, then that helps to build the self-worth. So, right, so you see it's a cycle and it's a foundation. And when you have that strong foundation, it sets everything up. And then conversely, when you don't have that foundation, it then starts to start to become a part, and really we start to see it in all areas of life, right? So for children, we might see it with problems with learning or paying attention, getting along with others. We may see kids that are, quote unquote, colicky when they're babies, or infants, but really what's going on may be much more deeper than that. And then eventually we may see withdrawn behaviors or aggressive behaviors. Next slide, please. And then last, but not least, and I would say that those other slides also are considered, therapeutic, quote unquote, approaches to addressing trauma, because it's not just a one thing, right? And that, you can't treat trauma, right? We don't treat sexual abuse. We don't treat, a neglectful parent. We're treating really, or addressing what trauma has done to the overall person, right? And so there are many things that are going to be going on with patients all at once. And so identifying trauma in a person's life and a person kind of confronting or addressing that trauma is not going to just fix everything. But again, it's a foundation. And so overcoming trauma really requires action, right? Effective action, accessing the emotional brain. So when we work with patients and patients find ways to not be afraid to feel what they're feeling, that's a first step in really being able to sit with themselves, to incorporate the trauma so that trauma becomes a part of their life, but is not what's dictating the way they live their life. And so there are a lot of different clinical modalities through therapy, and I listed a bunch there on the left-hand side. There's some newer ones that are very, very effective with trauma survivors, but we also see things like body work. So getting connected to a person's body, breathing techniques, even things like Reiki and acupuncture are helpful in addressing trauma and not just specific, right, like pain. And then of course we know that medication can help and supplement a lot of this other type of work and support. And it's not a one size fits all. And so every person's going to be different. So it's just really useful to know that there are a lot of options, in that just beginning this dialogue with a patient can really open the door to a lot more opportunities for people to feel better. Next slide.